In 2015, global communities launched the implementation of the Improved Services for Vulnerable Populations (ISVP) program, also known as Twiyubake in Rwanda. The ISVP was a 5-year program funded by the United States Agency for International Development, USAID, and President's Emergency Plan for AIDS Relief, PEPFAR. The goal of the Twiyubake program was to identify and assist 50,000 vulnerable households consisting of 250,000 individuals who include the most vulnerable children, youth, and their caregivers by reducing economic vulnerability and empowering parents to make investments to meet the unique needs of young children and adolescents. The ISVP program was implemented in 12 districts, which were selected in all the 4 provinces of Rwanda and city of Kigali.
Selection of these districts was based on the HIV prevalence and the number of the most vulnerable children in Rwanda. So this was a joint effort between USAID Rwanda and the government of Rwanda, more specifically the Ministry of Gender and Family Promotion and the Ministry of Health, which were the line ministries that the program directly worked with throughout its implementation.
Twiyubake targeted vulnerable populations, including people living with HIV, orphans and vulnerable children, out-of-school youth, particularly adolescent girls and young women, and very poor households, especially female and widow-headed households. 5 years down the road, beneficiaries to the program say their lives have changed for the better, from being economically empowered to knowing the best health, parenting, gender, wash, and nutritional practices. Aimable Nkurikiyeyezu, a resident of Mahwa Village, Kabatwa Cell, Kigoma Sector, Huye District, is one of the beneficiaries who received conditional household grants and saving incentives through their savings group to completely turn around his household and living conditions. Nkurikiyeyezu was just a subsistence farmer, merely surviving and in the first category of Ubudehe. He joined Twiyubake program in 2017, where himself and others formed an integrated savings and lending group, starting with a share of 100 Rwanda francs, graduating to 200 Rwanda francs. Each member contributes 5 shares worth 1,000 Rwanda francs every week, but Nkurikiyeyezu is able to save up to 15 shares worth 3,000 Rwanda francs weekly.
Yinawo mukene mpingira amafaranga naye ntunzwe no guca ishuro kurya n'iryaga bingoye tukimara kubona na Twiyubake badushyize mu matsinda yo kuzigama no kugurizanya twabanje ku giceri cy'ijana ariko umukozi wa Twiyubake atubwira ko igiceri cy'ijana ntaho cyageze umuntu nibyibura se uburyo twakungura umugabane ishyura umugabane wa 200 ubwo no kuvuga ngo wizigamaga imigabane 5 yari amafaranga 1,000 twizigamaga imwe mu cyumweru.
The model farmer who now saves 80,000 Rwanda francs a month is building himself a house, has livestock, and is one of the leading farmers in the district. Nkurikiyeyezu plans to inscribe Twiyubake on his new house when completed.
Mare byanzu ndimo nubakariya mfite intego yuko nzakorotira burana ma kwiyubaka ku muryango nkandikaho Twiyubake Duamike Kigoma mu kagari ka Kabatwa.
His story is similar to that of Jean de Dieu Kanyabuganda, who used to rear pigs the traditional way, but their growth rate was not appeasing. Today, he is the source of piglets for people who want to start piggery projects in his community as a result of receiving business development services from the program.
Kera noraga ingurube uko bisanzwe ntizikure ntizirengombese gasanga ikora mu gihombo ariko twiba kimaze kumpamagurwa izagakono nazivuyeho za muza kizungu bira byose nakoze nitibaki ko iyo ntagena ngo nwige banyigishe neza ko bigomba kumera ntago naga kubigeraho ariko ubu bikunteza imbere mubonye ko ibyana bisigaye bisakirwa iwanje.
Through Twiyubake program, beneficiaries in Musanze district were educated on how to save and use their savings to generate income to support their households. Twiyubake program also promoted the establishment and adoption of integrated early childhood development services within the community and homes where 60,715 children under 6 years were enrolled to receive comprehensive ECD services provided by a cadre of trained caregivers. Nezimana Jeanne Damour is a USAID Twiyubake community-based volunteer in Kayonza district. He commends Twiyubake for establishing an early childhood development center which focuses on promoting education, hygiene, health, nutrition, and inclusion of children with disabilities.
Nkatwe abakorerabushake tuba dufite uburyo twagiye tureba abana tukavuga ngo mukorerabushake n'ubuzima bwo mu rugo dukwiye kumenya umwana turera niba n'ubuzima bwo mu rugo hari ikindi kintu ababyeyi baba bamufasha tukagira umwanya wo kumusura tukareba ibijyanye n'isuku se tukareba ibijyanye n'ivy'imirire bimeze bite kwa ngiye tujya tugasanga harimo imiryango ikenye kurusha y'ahandi hasi hari ibintu ibura tukavuga tutari kuri umuntu akeneye ubufasha.
The Igihozo ECD Center, established in 2016, now supports 60 children between 3 and 6 years, particularly those from vulnerable families, to support their comprehensive development. Twiyubake, with support from the private sector, gave the center a head start by contributing building materials like cement and iron sheets to complement efforts of the parents. Mukamurenzi Jacqueline is one of the beneficiaries who has a child with disability supported by the ECD. Before the establishment of this center, Mukamurenzi used to leave her child with others when going to work. They would also abandon the child, leaving him in isolation. But when the ECD center was established, with the support of Twiyubake, she now has a place to leave her child with others.
Iri rero rimaje kuhagera naramuzanye ubwo umwana akajya mu bandi agakina aho yabaga yicaye agakina n'abandi bana ubwo yabonaga uko abandi bana bari kugenda bakina bari kwiruka bakina n'umupira ubwo nawe agira ishyaka ryo kuba yahaguruka nawe agakina n'abandi ubwo umwana ngiye kubona mbona umwana aragenda ubwo n'ubu ngubu ajya mu bandi rwose umwana agakubita umupira rwose agakina.
In a bid to complement the government of Rwanda's efforts to reduce the risk and impact of HIV and AIDS, USAID Twiyubake, through the support of USAID PEPFAR, carried out different activities over the past 5 years that were aimed at minimizing the risk and promoting positive attitudes. Ephigenie Nyirayoboka is a case management volunteer and a resident of Ndera sector in Gasabo district. She lost her husband to HIV and AIDS in 2006 and later tested positive in 2010, after which she decided to start treatment and encouraging others to do so. When she joined Twiyubake program in 2016, she was sensitized about proper ways for adhering to care and treatment and seeking for PMTCT services for pregnant women.
Twiyubake yagerageje kuduha amahugurwa. Baduha amahugurwa yo gufata kuri gahunda yo gufata imiti neza ko tugomba kujya tubikangurira abantu no kwipimisha buri munyetsinda akamenya uko ahagaze n'abandi bantu muri rusange. No kuvuga ngo muri rusange nk'abantu maze guha ubutumwa bya gahunda byizo gahunda zose nkubwira ni benshi cyane. Navuga ko bashobora kuba bagera mu gihumbi.
Bituma tugira morali, bituma tubona ko tutari twenyine. Nyine urabona nkuko kuba tujya kwa muganga hashize n'igihe kirekire hari wenda nk'ibindi bintu bishya bamutumye akaza kabidushishikariza.
Twiyubake program has helped Nyirayoboka and Dusabe rebuild hope amongst themselves and understand that there is life after contracting HIV and AIDS. In line with supporting the youth to become economically resilient, Twiyubake program supported Tuzamurane and Twisungane youth savings groups located in Chanika sector, Burera district. This is after they showed a strong commitment towards a culture of saving and invested in multiple income-generating activities in agriculture.
Twisungane bayihaye inkunga ya $880 ibihumbi $880 noneho Tuzamurane babaha miliyoni iri kurenga. Ubwo rero ibyo byaradufashije bituma twongera ibikorwa byacu noneho tubasha gutera imbere. Ubu duhinze imirimo 5 y'ibirayi twagiye umwe tuhatisha ku mwaka ibihumbi 200. Ubwo rero twishura miliyoni dushoramo ibimbuto y'ibirayi ihinganye na toni imwe ku kilo ni 600 tukiguraho cy'imbuto bihinganye n'ibihumbi 600.
The youth club has constructed a total of 58 kitchen gardens, plastered 4 houses, and built 13 pit latrines for vulnerable households in their village. USAID Twiyubake trained the youth savings group on financial education, saving methodology, work readiness, and cooperative governance and management. The program also provided saving incentives and business grants to support the groups to expand their business activities. 5 years on, youth beneficiaries say they were able to acquire the necessary skill set to turn around their socio-economic status through improved agricultural practices, savings, and business skills, thanks to Twiyubake, which provided TVET scholarships to 1,184 out-of-school youth. Bihoichi Lawrence, one of the TVET graduates, is a resident of Murundi sector in Karongi district. She had dropped out of school due to lack of school fees. She later joined a youth savings group where through Twiyubake, every member was encouraged to save at least 500 Rwanda francs every week. Given her determination, she was selected to go for technical and vocational education and training, pursuing a course in hairdressing at Kayenzi VTC. Thanks to her savings, she was later able to apply for a loan through the Business Development Fund BDF. Having started with 70,000 Rwanda francs, today Bihoichi runs a salon and airtime vending business worth 500,000 Rwanda francs in capital and still counting.
Yampaye ubumenyi ndiga. Maze kwiga nize mu gihe kingana n'umwaka. Naje kuri tere ndakora, ariko mu gukora natangije amafaranga nari nakuye mu kwizigama Twiyubake yari yagiye itwigisha. Nari mfite amafaranga agera ku bihumbi nka 70 kuko twaragabanye umwaka urangiye mbona nk'amafaranga 70. Nibyo natangije nkora salo. Mu gukomeza gukora salo nagiye ngenda nunguka nkabona abakiriya ngeza ku bihumbi bigira nko muri 250 mpita nkora mobile money. Mobile money na nisanda cyayikora kandi nkomeje n'ibya salo.
After deducting all business expenses, Bihoichi remains with a net income of 50,000 Rwanda francs per month.
So it was a journey between the program, the volunteers, and the beneficiaries, whereby the beneficiaries were put in the driver's seat and empowered and provided with resources to ensure that they reach a level of self-reliance, which was the ultimate goal of the program.
This can be attested by members of the Nyarugunga Dreams Cooperative, who say that through Twiyubake, they acquired lifelong skills that will help them to sustain themselves long after Twiyubake has phased out. Nzabamwita, who along with others ran a hair salon and a tailoring workshop in Nyarugunga sector, Chichuchiro district, says that today the girls and women through their projects and savings group have improved their incomes and can sustain their families ever since they joined Dreams in July 2018 when it was introduced in their sector.
ubu ngubu ubuzima tugezemo uyu munsi wa none kuri uyu munsi dufite ubuzima bwiza abantu bose barabwifuza kuko ubu ngubu wari indaya yarabiretse ubu baraza tukizigama twizigama buri wa gatanu ubu tugeze kwizigama buri munyamuryango wizigama 3,000 bya buri cyumweru.
DREAMS stands for determined, resilient, empowered, AIDS-free, mentored, and safe. It targets adolescent girls and young women that are in the age bracket of 10 to 24 years to prevent new HIV infections through provision of a comprehensive package of interventions which focus on avoiding and reducing risks of acquiring HIV. Twiyubake program supported 15,073 adolescent girls and young women, including female sex workers, teen mothers, in school and out of school girls from Nyarugenge and Kicukiro districts. The Twiyubake program also provided services to promote safe transition of youth into adulthood, which included provision of education on sexual and reproductive health and rights and training on life skills. The USAID Twiyubake program also promoted and strengthened community-based nutrition promotion interventions in order to ensure that pregnant, lactating women and households with children under the age of 5 were participating in community-level nutrition interventions and practicing promoted infant and young child feeding behaviors. In Murandi Cell Remera sector, Musanze district, beneficiaries attest that Twiyubake supported them to not only improve their household incomes, but also to live healthier lives through improved nutrition.
Ariko naraye mu kiraro abana bangiye baragwaye imvunja niyo bari mu mirire mibi ariko Twiyubake ahiziye ndi umugore ugaragara usobanutse witeje imbere udashaka no kongera gusubira mu cyiciro cya mbere narangije no kwiyakira mu mutima wanjye ndiyamamaza ndatorwa ubundi mudugudu ndi umugore uhagarariye abandi.
Over the last 5 years, households that have worked in groups have been able to come up with businesses which have positively impacted individual and household incomes. Twiyubake beneficiaries say the program did not only help them build their capacity to respond to and overcome conditions that cause vulnerability, but it has also given them lifelong socio-economic skills they can pass on to others, such as the savings culture.